Omicron continues to sweep the world. Last week, there were more than 18 million reported cases. The number of deaths remains stable for the moment, but we're concerned about the impact Omicron is having on already exhausted health workers and overburdened health systems. In some countries, cases seem to have peaked, which gives hope that the worst of this latest wave is done with, but no country is out of the woods yet. I remain particularly concerned about many countries that have low vaccination rates, as people are many times more at risk of severe illness and death if they're unvaccinated. Omicron may be less severe, on average, of course, but the narrative that it is mild disease is misleading, hurts the overall response, and costs more lives. Make no mistake, Omicron is causing hospitalizations and deaths, and even the less severe cases are inundating health facilities. The virus is circulating far too intensely, with many still vulnerable. For many countries, the next few weeks remain really critical for health workers and health systems. I urge everyone to do their best to reduce risk of infection so that you can help take pressure off the system. Now is not the time to give up and wave the white flag. We can still significantly reduce the impact of the current wave by sharing and using health tools effectively and implementing public health and social measures that we know work. I'm proud COVAX delivered its 1 billionth dose over the weekend. Of course, it's not enough, and we should do more. At a time of Omicron, it remains more important than ever to get vaccines to the unvaccinated. Vaccines may be less effective at preventing infection and transmission of Omicron than they were for previous variants, but they still are exceptionally good at preventing serious disease and death. This is key to protecting hospitals from becoming overwhelmed. We have been able to track new variants like Omicron and this virus evolution in real time thanks to efforts of thousands of scientists and experts around the world. More than 7 million whole genome sequences from 180 countries have now been submitted to GENEVA, which was initially set up to track flu. This pandemic is nowhere near over, and with the incredible growth of Omicron globally, new variants are likely to emerge, which is why tracking and assessment remain critical. New formulations of vaccines are being developed and assessed for how they perform against Omicron and other strains. I'm concerned that unless we change the current model, we will enter a second and even more destructive phase of vaccine inequity. We need to make sure we share current vaccines equitably and we develop distributed manufacturing around the world. We can only beat this virus if we work together and share health tools equitably. It's really that simple. On Friday, WHO recommended 2 new COVID-19 treatments based on data from 7 trials, again increasing the arsenal of tools used to fight severe illness and death. a rheumatoid arthritis drug called baricitinib, and a monoclonal antibody called sotrovimab. Again, the challenge is that high prices and limited supply means access is limited. WHO is working with our partners in ACT Accelerator to negotiate lower prices with manufacturers and ensure supply will be available for low and middle-income countries. We urge manufacturers to use WHO's COVID-19 technology access pool to share technology, know-how, and voluntary licensing in order to facilitate increased production capacity globally, which would save the most lives. WHO's COVID-19 clinical management guidelines have been critical to policymakers and health workers so that they can access the latest information on how best to treat patients with COVID-19. Sharing clinical data remains critical so that WHO can generate up-to-date scientific evidence regarding Omicron. WHO invites all member states, health facilities, and research networks to voluntarily contribute to the WHO Global Clinical Platform for COVID-19, which is available through our website. Next week, the WHO Executive Board, which is made up of 34 member states, will meet to discuss the world's health challenges. The pandemic will remain at the forefront, particularly how to more effectively share tests, treatments, and vaccines equitably, and to meet the 70% vaccine target by July 2022. However, the impact of the pandemic on other health issues has also been devastating, and member states will be discussing how we can stop the backsliding and recover together. WHO will be working to accelerate progress on negotiations around a pandemic accord, as well as sustainable financing. If we're serious about strengthening health systems, preparing for future pandemics, and tackling the litany of health challenges we collectively face in a heating world, WHO and the whole global health infrastructure will need to be sustainably financed. Reports from the Global Pandemic Monitoring Board, the Independent Panel for Pandemic Preparedness and Response, and the Review Committee on the Functioning of the International Health Regulations all recognized the need for predictable and sustainable financing at all levels of the organization.